Hi everyone, welcome to Nursing Wisdom at R. Today let's move to the topic called personality disorder. Personality disorder are long-term pattern of behavior and inner experiences that differs significantly from what is expected. Like it's a pattern of behavior, like something we expect from the patient. What we expect from patient is it's not be observed in that patient. Like their personality traits will be inflexible. There will be an unhealthy pattern of thinking or functioning or anything like behaving. Like there will be not observed normal behavior in the patient. There will be observed abnormal behavior in one or another thing. Let's move to the classification broadly so that we can understand what are the causes of the patient to the which leads to the personality disorder. Like cluster A, cluster B and cluster C. It can be classified mainly under the personality disorder. Cluster A. First one, paranoid personality disorder and schizoid personality disorder which involves under the cluster A. Let's see what is paranoid personality disorder. Like directly we can say that paranoid personality disorder is lack of trust. Like there will be no trust in each and anyone around the patient. Patient will be having feeling of the people around him does do something to harm him, or the people around him are against him or against his decisions. He feels like not believing in anyone around him. Like there will be a lack of trust around the people, around the patient, on the people. Let's see the schizoid personality disorder. I hope you understood paranoid personality disorder. Schizoid personality disorder, we can say that lack of interest, like the patient in this person, patient or the person who is having schizoid personality disorder, he will be not having interest in anything, like lack of interest, like the people around him may involve in other activities or like exercise or games or any programs, but this person feels like sitting loneliness in the corner. He don't want to involve in the people around him, or he don't want to involve in the other activities around him. That is nothing but which indicates schizoid personality disorder. So let's move to the cluster B, in which cluster B, like first one is antisocial personality disorder. In the name itself it indicates that antisocial, like anti against social society. In this person, the person who is having antisocial personality disorder, this person is always behaves against society, like he will be not encouraging or not supporting to the society activities. He don't involve in the people around his society. He will be sitting lonely in the corner. He don't want to involve in the society things. Same as a schizoid personality, like not having an interest. Next, narcissistic personality disorder. What it means? It means that self-centered, like he will be praising himself. Like example, I'm handsome, I'm beautiful, I'm very talented, comparing the world. Like he always compares the people around him and him with the upper level. Like he feels like he is the very talented one, very handsome one, or any or anything. He will feels like he praises himself in the upper level comparing others. That indicates nothing but narcissistic, like self-centered. Next, histrionic. Histrionic means the person always seeking attention, like can be called attention seeking disorder, like center of focus we can tell. Like he feels like he will be in the middle of the people. He feels like he will be center of the focus and the comparing the people. Like he grabs the attention of the people. For example, a girl with having the histrionic personality disorder, she may make up more or she may look beautiful more. Like she will grab the attention from other people. That is nothing but histrionic personality disorder. Next, on borderline personality disorder, like it's unstable. We cannot predict the behavior of the patient. Cluster C, dependent personality disorder, in which this person always depends upon the person or any things, in which he cannot do anything from independently. He always depends in one or other thing. Avoidant personality disorder, in which this person feels like if there is any avoidance, like if you go to communicate with anyone, he feels like if he feels negligence from that people or from that person, he feels like if he feels that rejectable from that person, that fear of avoidance is the personality disorder. OCPD, obsessive compulsive personality disorder, in which the person will repeatedly doing things. I hope you understood cluster A, cluster B and cluster C. So let's move to the clinical manifestations. Like there will be some symptoms in this personality disorder patient, like mood swings. There will be always mood swings from one time to another. Neglected hygiene. He will be not maintaining the hygiene. And over emotional. Yes, there will be emotional. Like there in some clusters we have seen that the patient is sitting in alone. He don't want to involved in the activities, in which he will be having the emotional things also. Taking risk, the patient may take any risk having any personal disorder. Strange behavior, arranging things in specific way, you have seen in OCPD. And repeated checking things, the person will check the things again and again repeatedly. Etiology, because of the genetic and hereditary factors, because of family history, because of consuming any chemical substances, because of childhood trauma like injury during the childhood, parental rejection, like I have already told that avoidance personal disorder, in which he will be having the avoid fear. Same thing here, the rejection of the parent will leads to the personal disorder, child negligence, low self-esteem, brain dysfunction or experiences of loss also leads to the personality disorder. I hope you understood all the personal disorder things. It is mainly cluster A, cluster B and cluster C. Thank you.